Good morning, everyone, and thank you very much, Rosaline. It's a pleasure to be here today. It's a pleasure to be able to introduce what we do and our great collaboration with Amyloidosis Ireland. I'm going to start by telling you a few words about Mended Hearts Europe. We're a young, old organization. Mended Hearts Europe is part of the Mended Hearts Group, which was launched back in the early 50s. Back in the time, a cardiac surgeon had the idea to bring into his office 4 of his patients, not to talk about medical conditions, but to talk about life after medical surgery, to share their lived experience of a patient, what was their everyday experience after such a traumatic experience. And that's how Mended Hearts was born. Fast forward 74 years, today Mended Hearts is 124,000 members in 44 countries, all patients. And we've become the world's largest peer-to-peer support, cardiovascular support network. We support patients of all ages and all cardiovascular diseases and comorbidities. Today we have 3 distinct groups. Little Mended Hearts for children born with congenital heart disease from up to the age of 18. The Young Mended Hearts for the 18 to 55 age group, and the Mended Hearts for the 55 and above. Sharing, again, resources on all cardiovascular diseases. Every year, our communities, our groups, are online, offline. It's over 200,000 patients who go through one form or the other of peer support. We have agreements with hospitals in the US where our volunteers actually go into the hospital's bedside to those who wish to meet with someone. We have welcome home programs, which are weekly programs which are provided to patients who are witnessing a new cardiovascular disease. And every year, over 200,000 patients go through this peer support, and online providing support to 7 million people who have access to our resources. We provide training to our volunteers to make sure that whatever they say and tell to those patients is under a certain, I would say, framework. The other, I would say, major element of Mended Hearts is the education. We provide education on all cardiovascular disease, or most cardiovascular diseases, of course, including amyloidosis, but I'll come to this. And providing this under multiple forms, whether discussion guides, go-to guides, infographics, webinars, whiteboard animations, name them. We try to provide, and we do provide that form of education to make sure that the patients are empowered and understand their disease. We have our Heartbeat magazine in the US, and of course, through multiple events, we go and meet directly with the patients. When I say we, it's the patients go directly meet with the patients. I'm not a patient myself, but I work for patients, and I work passionately for patients. And the final piece of Mended Hearts is the advocacy piece. In the US, we have the Mended Hearts University, where we train over 200 patients per year to become patient champions, patient advocates, to be able to speak in places like this, but also to be able to speak to their policymakers about their disease and to be able to be the voice of their disease. So it's been going on for 74 years in the US, but Mended Hearts in Europe, actually, we're celebrating this month our 2-year anniversary. Our president, who is himself a patient, he's a heart attack patient, stroke patient, cancer patient, and diabetes patient. He had the idea to launch and to expand Mended Hearts into Europe, and that's how we were formed 2 years ago. I'm based out of Geneva, Switzerland, and we operate with a license from Mended Hearts Inc., exclusive license allowing us to use all the brand and the resources of Mended Hearts Inc. Our vision is that we believe that in a world where every single cardiovascular disease patient has the resources and support to live a healthy life, the mission very much mirrors the mission of Mended Hearts in the US, is to support, educate, and advocate. But of course, we follow a different objective. We don't have the ambition to create a network of chapters or communities like in the US, but to work alongside patient organizations such as Amyloidosis Ireland or the Heart Failure Warriors here in Ireland, and to provide them with the support we can. The first objective is to import, adapt, and translate all the US educational resources, and I insist on the adaptation. We're not bringing to Europe US materials. we are creating European materials for Europe, and we have created Irish materials for Ireland. They've been reviewed by Rosaline. Of course, every single material we provide has been medically approved and medically reviewed, so it's extremely important that we are conscious of the differences and the local. We do not have this will to bring US to Europe. We want to be a European and Irish as much as possible organization. And then collaborating with local groups to develop peer support, again, where needed. And the final piece of the puzzle is to eventually empower patients to become champion advocates. I mentioned this in Ireland. We're working, of course, with Rosaline, and we're very proud to be releasing those materials at this conference today, but also working with the Heart Failure Warriors to provide them with educational materials. If you go to their booth, you'll find the resources over there, and working with them in developing a Welcome Home Heart Failure program, which is a peer support program for Irish patients with heart failure. At Mended Hearts, we really believe that education is the first step to empowerment. It's in line with our mission, and these 7 steps to become an empowered patient are designed to make individuals take control of their health, engage confidently with HCPs, and become active partners in their care. The first step is to take control, educate yourself, know your rights, be part of the team, get information, voice your opinion, and make informed decisions. And it's not to make the patients go against HCPs, of course not, and we do not, and I'm standing in front of healthcare professionals, but it's really to facilitate the discussion, facilitate the understanding of their disease for the patient so they can have an engaged discussion with their HCP. Our educational resources help patients feel more confident and involved. They're designed to support the patients, but also the caregivers and their families with essential information. And really, I want to insist, it's written in lay language. Most of the patients, and I'm guessing most of you patients in this room, were not medical professionals before you were diagnosed. And it's hard to understand when you're not a medical professional. So everything we do is made to be understood easily by the patient. Our materials allow to recognize your symptoms, to understand how to obtain a diagnosis, to manage your condition, and to communicate with the healthcare professional. And all of our discussion guides contain our questions to ask your doctor, which really empowers a patient to engage in a meaningful conversation with their HCP, and really, especially for those who have just been diagnosed. And I was actually quite stunned to hear patients telling me, those who were diagnosed with amyloidosis, ATTR-CM, that they had no understanding of what was happening, and suddenly got home and realized that I have this one memory of this person telling me he was a widower, his wife was a widower, he got diagnosed, got home, and read in a pamphlet that he had 6 months to live. And he did not know who to speak to and how and what was going on in his life. Thankfully, that was 10 years ago, so that's great news. But it just shows how important education is important so that you're not left alone when you're diagnosed. So today, again, very proud, and the leaflets are outside, so please feel free to take them. We're releasing the discussion guide on AL amyloidosis. It's, again, a partnership, and I did not do this alone. We did not do this alone. We did this with Rosaline. She asked us to change text. She asked us to change colors. We wanted to make sure that she owns this document. And we will be soon launching. This was rushed so that it was ready for the conference so that you can actually have a copy of it. But we'll also be launching a whiteboard animation, and of course we'll be making a big bang with Rosaline around World Amyloidosis Day. We're actually launching a similar collaboration with Amybel in Belgium. They wanted to be here today, but apparently it was full, so they couldn't get in. And this resource has been developed with the support of Alexion. And the final resource, second resource that we're releasing today is the ATTR-CM discussion guide. Again, it's available outside. Please feel free to take copies. The copies are there for you. Again, similar program run. We're adapting a US guide. It's been adapted by cardiologists, co-created with Rosaline, and we're also launching a similar partnership with Amybel in Belgium, and this was developed with the kind support of BridgeBio. So thank you to them. So with that, thank you very much, and I'm available for any questions.